Pregnancy is supposed to be a happy time, but what if anxiety takes over? You're not alone. Many mothers or to be mothers are often anxious. And anxiety is not something simple, but it is a diagnosable condition. Anxiety disorders affect millions, including pregnant women. And anxiety is more than just a worry. It can impact your daily life. It can be excessive and it can be ongoing. And here's how pregnancy can impact your anxiety. So, why do pregnant women feel more anxious? That's because of hormonal change, emotional load, and physical discomfort, and that leads to a spike in anxiety. And if you have a history of anxiety, then it could spike more during pregnancy. So, here are some of the common anxieties that you could face during pregnancy. The first one is social anxiety, not wanting to go out in public, attend social gatherings. It could even be your own baby shower. And in some cultures, like Asian cultures and South Asian cultures, there's a lot of family expectation about social gatherings where you need to meet often and many times in a larger group. During times like this, pregnant moms and new moms tend to feel anxious, and especially if you have an anxiety disorder. What are comments that could affect you even more? Comments like, are you sure you're going to be a good mom given that you're so messy? Oh, you've gained so much weight. When are you going to lose that weight? And before going for any social gathering, you may start feeling anxious just thinking about the comments that will follow. So you tend to avoid social gatherings. You feel increased sweating. You also face the fear of rejection or being judged when you go for these social gatherings. The fear of being judged, whether it is the way you parent or your body, even childbirth plans can lead to social isolation where you prefer spending more time at home alone than with other people. Now, the second one is generalized anxiety disorder or GAD. What happens here is that even small day to day things that normally wouldn't affect you start affecting you. You start thinking every day, is my baby fine? Why didn't she move today? What if I'm not a good mom? Will we be able to manage all the expenses? So small thoughts crop up and turn into a big worry. And this also leads to anxiety. The problem here is it does affect your sleep, where you find it hard to fall asleep and stay asleep during the night. The physical symptoms here are restlessness, headaches, and nausea. Imagine feeling on the edge all the time regarding what you eat, whether I'll be a good parent or not, and all this comes under GAD or generalized anxiety disorder. The third one is panic disorder, where you suddenly get an overwhelming feeling of panic, and this could arise anywhere, be it in the grocery store, in the hospital, or when you're walking down the road. You suddenly feel your heart palpitating with fear and you don't know why. Your chest starts to close up. Does this sound familiar? The physical symptoms here are racing heart, dizziness, and shortness of breath. Now, panic attacks can be terrifying, especially during pregnancy, because you don't know when it's going to come up. Your body is already changing, and then you feel that you may faint when actually there is no physical danger around you. Agoraphobia is the fourth one, and that is the fear of being trapped or being helpless. This often happens when you're flying in a plane, so you feel trapped for a certain amount of time, or when you go to crowded gatherings, any place where you feel unsafe or you cannot leave that place on your own will. So you start avoiding places and situations where your escape seems impossible. This again leads you to staying at home and you face isolation. Some women go through all these anxieties and faces anxieties not knowing why it is happening to them, which makes it even scarier for them, because then you don't know how to handle or who to approach when you feel such things. You also may feel it's not normal, but there are many women who are going through it and it is normal. It's just very important to seek help when you're going through any form of anxiety, especially during pregnancy. Now, the last form of anxiety is other phobias: fear of needles, the fear of having to give birth or going through the pain. When you go to the doctor's office, you may clutch your fingers, clutch your hands tightly with the fear of being injected. And a lot of women delay their medical checkups because of these fears as well. And during pregnancy, it is very important to go on time for your checkups. If you have any of these fears, please do let your doctor know. Now, these anxiety disorders during pregnancy may seem very scary, overwhelming, but remember, they are all treatable, they are all curable, and you need to take that first step to ask for help. Seek help at the right places. Now, if you have a partner, if you have a spouse, they also play a very important role in helping you with your mental health. So please have them watch this video as well to know how to support you. Even your presence could be enough support to your pregnant partner. Just by reassuring your partner and listening to her is a bigger help than you think it is. If you find yourself facing any of these symptoms, work on it right at the beginning rather than letting it be too late. You can do things like practice deep breathing, meditation, or yoga. Go to somebody who is qualified in prenatal yoga. You can also go through some self help guides if you feel it's manageable on your own, or if you feel it is getting out of hand, it's affecting your partner as well, and they do not know how to help you through that, then please consider seeking therapy.